Hello, friends. Imagine blowing out the candles on your 65th birthday. You are still working, you feel perfectly healthy, and you look at the stack of confusing Medicare paperwork on your counter and decide you just do not want to deal with it right now. You assume, like millions of others, that you can just sign up next year when you finally hand in your retirement keys. But a year later, you log on to the federal Medicare website to enroll, and the system completely locks you out. You call the hotline, and the agent delivers terrifying news. Because you missed your initial enrollment period, you are legally banned from signing up until a specific window opens next year, and when you finally do get in, you will be hit with a permanent financial penalty on your monthly premiums for the rest of your natural life. Millions of seniors fall directly into this Medicare late enrollment trap every single year. If you do not understand the exact 7-month window the federal government gives you, you could find yourself completely uninsured in the middle of a catastrophic medical emergency. I want to be perfectly clear right from the start. The government isn't permanently banning you from Medicare for the rest of your life. And this isn't a scam. The ban refers to the strict federal enrollment lockout that legally blocks you from signing up outside of specific windows, punishing you with permanent financial penalties if you miss your initial deadline. But if you stay with me until the very end of this video, you will know exactly how this system works, how to navigate the timelines, and how to use the official forms to protect your savings. Rules change every single year, and the government is never going to call you to explain your options. The people who subscribe to this channel find out about these changes in time. The ones who do not usually find out after their hard-earned money is already gone. Let us start with the absolute baseline that governs your entry into the system, the 7-month initial enrollment period. The Social Security Administration will not send a representative to your house, and they will not mail you a warning countdown. Federal law grants you a strict 7-month window based around your birth date, and if you miss it, the digital door slams completely shut. We call this the 3-1-3 rule. To map this out on your own calendar, here's exactly what you need to do. First, circle the month of your 65th birthday. Second, count backward exactly 3 months from that month. That is the precise day your initial window opens. Third, count forward 3 months from your birthday month. That is the exact day your window permanently closes. To guarantee you have no gaps in coverage, your goal should always be to enroll during those first 3 months before your birthday. Doing that ensures your coverage begins on the exact first day of your birthday month. Let us look at a real person example to see how the math plays out over a life. Take John, who turns 65 in June. His initial enrollment period opens on March 1st and runs all the way until September 30th. If John files his paperwork on April 15th, his Medicare Part A and Part B coverage seamlessly kicks in on June 1st. His out-of-pocket gap during that transition is $0. But look at what happens if John delays his paperwork and waits until September 20th, the final month of his window. His coverage will not start until October 1st. If John suffers a sudden heart attack in July, he is 100% responsible for the $50,000 hospital bill because his Medicare was not active yet. Now, there is a major situation variation you must watch out for. If your birthday happens to fall exactly on the first day of the month, let us say your 65th birthday is June 1st, the federal government legally treats you as if you were born in the previous month of May. That means your entire 7-month window shifts backward by 1 full calendar month. Most people never check this, and they end up missing their closing date because they calculated from the wrong month. But what happens if you completely miss that 7-month initial window? This brings us to what I call the winter waiting room, known officially as the General Enrollment Period. If you miss your initial window, you cannot just log online in October or November and sign up because you changed your mind. You are legally locked out of the Medicare system. Federal law dictates that you could only apply during the General Enrollment Period, which runs strictly from January 1st to March 31st each year. If you realize your mistake in May, you cannot enroll. You must wait completely uninsured through the summer, through the fall, and into the following January, just to hand in your application. Your action plan, if you find yourself in this situation, requires strict calendar management. First, recognize that you missed your initial window and stop trying to submit standard applications online out of season. Second, mark January 1st on your calendar as the hard date to file your application during the General Enrollment Period. Third, understand that under the current federal guidelines, Your coverage will not start the day you apply. It begins on the first day of the month following your enrollment. For example, if you enroll in February, your active coverage starts on March 1st. Fourth, you must prepare yourself mentally and financially to pay a lifetime penalty when that bill finally arrives. To see how devastating this winter waiting room can be, consider Susan. Susan turned 66 and completely missed her initial enrollment period because she was entirely distracted moving across the country to a new state. In April of 2026, she is suddenly diagnosed with a severe chronic illness that requires ongoing treatment. She panics and tries to sign up for Medicare immediately. Because it is April, the General Enrollment Period has just closed. Susan is completely locked out of the federal health system. She is forced to wait 8 full months until January of 2027 just to submit her application, and her actual coverage will not start until February of 2027. This means Susan must pay 100% of her doctors, her tests, and her treatments completely out of her own pocket for 10 full months. A single scheduling error like this can completely wipe out a senior's retirement savings before their coverage ever begins. And the financial hit does not stop when you finally get into the system. Missing these windows triggers the permanent premium spike, which is the federal government's 10% Part B lifetime penalty. This is not a one-time fine, and it is not something that falls off your record after a few years. For every full 12-month period you delay signing up for Medicare Part B without a legally recognized exemption, the government permanently adds 10% to your standard monthly premium. You will pay this extra percentage every single month for the rest of your life. The math behind this is very direct. First, look at the 2026 Standard Part B premium, which is exactly $202.90. Second, calculate the exact number of full 12-month periods you delayed your enrollment. Third, multiply those years by 10% to establish your permanent penalty multiplier. Fourth, calculate that dollar amount and add that extra cash directly to your base premium every single month. Let us watch this happen to David. David turns 65 but decides he does not want to pay the $202.90 premium because he feels perfectly healthy and rarely visits a doctor. He waits exactly 2 full years, 24 months, before he finally decides to enroll during a general enrollment period. Because David delayed his enrollment for 2 full years, his lifetime penalty multiplier is 20%. 20% of the $202.90 base premium is $40.58. That extra $40.58 is added to his bill, making David's new permanent monthly Part B premium $243.48. That means he is throwing away an extra $486 every single year. Over a typical 20-year retirement, that simple choice to delay enrollment for 2 years costs David $9,720 in pure non-refundable federal penalty fees. There is one critical situation variation where this penalty can be legally erased. If your income and assets are low enough to qualify for your state's Medicare savings program, which is administered through Medicaid, the state will step in. The state will not only pay your monthly Part B premium for you, but they will also completely wipe out any late enrollment penalties you accrued during your lockout period. But if you do not qualify for that state assistance, you are on the hook, and Part B is only half of the equation because the government also tracks your prescription drug coverage. The prescription drug penalty is what I call the drug premium surcharge, and it is even more aggressive than Part B because it does not calculate by the year, it accrues every single month you delay. If you go 63 days or more without what the government calls creditable prescription drug coverage after your initial window closes, Medicare will penalize you. Creditable means the coverage must be at least as good as a standard Medicare drug plan. If you do not have it, they add a permanent 1% penalty for every single month you went without it, and they calculate that penalty using the 2020-26 National Base Beneficiary Premium, which is exactly $38.99. To figure out how much this will cost you, follow these 4 steps. First, count the exact number of months you went without a drug plan after your initial enrollment period ended. Second, multiply that number of months by 1%. Third, calculate that final percentage against the $38.99 national base premium and round it to the nearest dime. Fourth, Take that rounded surcharge and add it to the premium of whatever private Part D prescription drug plan or Medicare Advantage plan you eventually choose. Let us look at Robert's situation. Robert does not take a single prescription medication when he turns 65, so he decides skipping Part D is a smart way to save a few bucks. Exactly 24 months later, he develops high blood pressure and needs coverage. He signs up for a private Part D plan that costs $15 a month. Because Robert delayed his enrollment for 24 months, he is hit with a 24% lifetime penalty. 24% of the $38.99 national base is $9.36, which the government rounds to exactly $9.40. The federal government forces his private insurance company to tack that $9.40 onto his monthly bill. His $15 plan now costs $24.40 every single month for life. He is paying an extra $112 a year, every year, just because he assumed he was too healthy to need prescription protection. Now, some of you are sitting there thinking, I do not have to worry about any of these timelines or penalties because I am still working and I have insurance through my job. That brings us to how you can bypass the lockout legally, using the active employer safe harbor, known officially as a special enrollment period. Federal law states that you are not forced to jump into Medicare at 65 if you are still actively working and covered by a group health plan through your current employer or through your spouse's current employer. This protection gives you a special enrollment period that allows you to delay Medicare without a single penny in fines. When you finally decide to retire or leave that plan, the government gives you an 8-month window to sign up for Part A and Part B completely penalty-free. But you cannot just tell the government you were working. You have to prove it with exact federal paperwork, and here is your step-by-step action plan to do it. First, walk into your Human Resources Department before you turn 65. Second, request written confirmation from your benefits administrator that your company health plan is officially considered creditable coverage by Medicare standards. Third, when the day comes that you finally retire, do not just log on and apply with a standard online application. You must obtain Form CMS-L564, which is the request for employment information. Your HR department must sign this form to verify your dates of employment and insurance coverage. Fourth, submit this signed form directly alongside your Part B application to instantly waive your lifetime penalties. Look at how this worked for Linda. Linda stayed on her company's group health insurance plan and worked until she turned 68. When she finally retired, she submitted her Part B application and attached her fully executed Form CMS-L564. Because the Social Security Administration received immediate official proof of her active employer coverage, they processed her application right away outside of the standard winter window. Her late enrollment penalty was officially calculated as 0%. She pays the standard $202.90 premium, saving herself from a permanent 30% premium spike that would have cost her thousands of dollars over her retirement. But this safe harbor has a hidden threshold that traps small business employees. The active employer rule strictly applies only if your employer has 20 or more employees. If you work for a small business with fewer than 20 employees, federal law dictates that Medicare automatically becomes your primary insurance the month you turn 65, and your company plan becomes secondary. If you fail to enroll in Part B because you think your small business plan covers you, your employer's insurance can legally refuse to pay your medical bills, leaving you entirely responsible for 100% of your healthcare cost while your lifetime penalties quietly accumulate. Even if you get your Part B active without a penalty, there is another massive trap waiting for you if you delay your supplemental coverage. This is the Medigap Underwriting Cliff. The Medigap Underwriting Cliff is what I call the 6-month pre-existing condition window, and it represents a massive point of vulnerability for your retirement. Original Medicare only covers 80% of your Part B medical bills, leaving you with an uncapped 20% financial liability. To cover that gap, most seniors buy a private Medicare supplement plan, also known as Medigap. Federal law grants you exactly one 6-month Medigap open enrollment period to buy this protection without a single health question. This window starts the exact first day of the month you are 65 or older and officially enrolled in Part B. During these 6 months, private insurance companies are legally banned from using medical underwriting. They must sell you the absolute best policy at the absolute lowest standard rate, regardless of your health history, your prescriptions, or your pre-existing conditions. If you miss this 6-month window, that legal protection vanishes, and they can charge you double or deny you coverage entirely. To secure this protection, you must execute these 4 distinct steps. First, calculate your 6-month Medigap windows starting directly from your Part B effective date. Second, do not confuse this window with the annual enrollment period that runs from October 15th to December 7th. That autumn window is for changing Part D and Medicare Advantage plans, and it provides 0 protection for Medigap underwriting. Third, choose your preferred Medigap plan, such as Plan G, and submit your application within those first 6 months. Fourth, finalize the policy to lock in your lifetime right to guaranteed issue coverage. Let us look at how this impacted Mark. Mark enrolled in Part B right when he turned 65, but decided to wait 8 months before applying for a Medigap Plan G because he was busy and feeling fine. Mark has a minor history of heart disease. Because Mark missed his 6-month guaranteed issue window by just 2 months, the private insurance company put his application through full medical underwriting. They reviewed his cardiovasculation, completely denied his application. Mark is now permanently exposed to the 20% uncapped out-of-pocket costs of original Medicare. When he needs a $100,000 heart bypass surgery, Mark is legally responsible for paying $20,000 straight out of his own pocket because he missed a 6-month paperwork deadline. This brings us to the most devastating administrative illusion in the entire federal health system. And it pays off exactly what I warned you about earlier, the COBRA Insurance Trap. Millions of seniors retire at age 65 and are offered COBRA extension coverage by their former employer, or they choose to transition onto a corporate retiree health plan. Because you are paying a massive monthly premium to keep your corporate insurance, you naturally assume you are protected and can delay your Medicare enrollment until that coverage runs out. This assumption is a catastrophic error. Under federal law, COBRA and retiree health plans do not count as current active employer coverage. The exact day you stop actively working for that employer, your 8-month special enrollment period clock begins ticking. It does not matter if your COBRA coverage lasts for 18 months. Your legal window to enroll in Medicare without a penalty expires exactly 8 months after your active employment ends. To avoid this disaster, you must follow this exact sequence. First, the moment you retire at age 65 or older, completely ignore the COB enrollment paperwork your former company mails to you. Second, enroll directly into Medicare Part A and Part B immediately through the Social Security Administration. Third, internalize the fact that paying $800 a month for COBRA provides you with exactly 0 legal protection against Medicare late enrollment penalties. Fourth, warn your retired friends about this administrative trap before they make the same mistake. Look at what happened to Richard. Richard retired at 65, and his company offered him COBRA for 18 months. He gladly took it, paying $14,000 in total premiums over that year and a half, fully confident that he was protecting his health and delaying his Medicare legally. At age 66 and a half, his COBRA coverage finally expires and he logs online to sign up for Medicare. The Social Security Administration informs Richard that his 8-month special enrollment period expired 10 months ago because he was no longer actively working. He is completely locked out of the system until the next General Enrollment Period in January. Furthermore, because he went more than 12 months without active Part B or creditable drug coverage, he is hit with a permanent 10% Part B penalty and a permanent Part D premium surcharge for the rest of his life. Richard spent a fortune on COBRA premiums only to accidentally destroy his federal health benefits because he did not understand the active work rule. Let us recap exactly what we covered today so you can keep these rules straight. First, you have a strict 7-month initial enrollment period based around your 65th birthday, which shifts backward a full month if you were born on the 1st. Second, missing this window locks you out of the system until the General Enrollment Period runs from January 1st to March 31st. Third, delaying Part B triggers a permanent 10% lifetime premium penalty for every 12-month period you miss, calculated against the standard $202.90 base premium. Fourth, delaying Part D triggers a permanent 1% monthly surcharge based on the $38.99 national base premium. Fifth, you can legally delay coverage using a special enrollment period only if you have active employer insurance with 20 or more employees, which you must prove using Form CMS-L564. Sixth, you have exactly 6 months from your Part B start date to secure a Medigap plan before private insurers can deny you for pre-existing conditions. Seventh, COBRA and retiree insurance do not count as active employment, and relying on them will trigger immediate penalties and enrollment lockouts. The Medicare enrollment system is a rigid timeline of absolute deadlines. By mastering your initial enrollment period and aggressively utilizing official HR forms to prove active coverage, you legally block the government from taxing your health care for the rest of your life.